This is National EMS Week. Agencies across the state are celebrating their EMTs and paramedics, but also warning that staffing shortages are putting healthcare at risk.
Our Pennsylvania State Capitol correspondent Kara Jeffers is joining us live tonight to talk about the solutions, Kara, that ambulance companies are now promoting. Good evening.
Good evening, Mike and Eva. Ambulance companies or EMS agencies are saying the key to getting more workers is better wages. But this opens up a can of worms called, how do EMS agencies get paid?
Back 30, 40 years ago, it was just a ride to the hospital.
EMS agencies started out as a public service offered by volunteers. The vocation evolved, though. It's now regulated by the state, and EMTs are held to professional medical standards.
It is a mobile ER. So how do you pay for that?
Most agencies charge a fee for service and rely on insurance reimbursements to pay that fee. Most reimbursement rates pay less than what it actually costs to deliver service.
Whether it's the cost of an ambulance or the cost of a cardiac monitor or the hourly cost of paying folks to answer those calls for us, all those costs have gone up while most of the reimbursement has stayed the same.
Agencies also have what's called a, quote, cost of readiness.
So we have 2 crews on duty around the clock at our building, and some shifts they might run 10 or 12 calls, and other shifts they might only do a couple.
The agency has to pay workers for the whole shift, an operational cost that no one pays them for.
The system won't survive on insurance reimbursement alone. There has to be another mechanism.
Directors say that because this continues to be an expected public service, local governments should chip in on that cost of readiness.
For, expecting service to be provided 100% of the time.
The issue of how to categorize and fund EMS dates back to the 1960s.
We identified that problem before we even put a man on the moon. And here we are in 2025 with the same struggles, the same narrative. We've come so far in society, but yet we still don't have ambulances funded.
Agencies really say that they want the state of Pennsylvania to regulate those reimbursement rates from at least private insurance companies. That conversation with cities and boroughs about municipalities kind of chipping in for that funding is going to take more conversations. Of note, most EMS agencies are still volunteer or nonprofit based. In Harrisburg, I'm Kara Jeffers, Erie News Now.
Kara,